Well, health experts say prenatal care during pregnancy is the best way to reduce a child's risk of developing water in the brain. The condition, which is also called hydrocephalus, is an abnormal buildup of cerebrospinal fluid in the cavities of the brain. TVC News' Esther Omokpariola reports. We warn, however, that some of the pictures may be disturbing, so viewer discretion is advised.
He writhes in pain, born with a condition that was none of his making. His parents, who barely have enough to sustain their family of 6, have had a hard time catering in his brain.
When I was in an operation, I wouldn't know anything. I didn't know, but they showed me the baby, said, "This is your baby." I know that it's a boy. It was very small. So after they took me to where they used to keep people that do surgery. So I didn't see baby. I thought that maybe he's died because the baby did not even cry. I did not hear his cry itself. I thought that maybe they are just flattering me that the baby is alive. So after 2 weeks, I been 1 week and some days, Dr. Nancy, I did not come and look my baby. I said, I did not know that. I thought that maybe my baby is normal. They said, no, your baby is sick, that is in the upstairs. My husband now took me to the upstairs. I didn't know that something like this is, I have never seen this kind of thing before.
Living in the shack of a home, most of their daily needs are met thanks to the benevolence of family and friends. And taking care of little Blessing in this condition has been the hardest part.
This my son have done operation, and before he done operation, we have been buying expensive medicine. Even I call some people around me. They say they should prepare agbo. I still pay for all those ones, thinking that it will be okay. It's one woman that helped my baby. When he see that the problem has much, call from my wife, through my wife, her. And now raise money for the operation of the boy. And he's going to another place. Say he's having another operation to do.
Hydrocephalus, simply termed water in the brain, affects children right from the first week of life till about 2 years. Doctors attribute this ailment to lack of folic acid in expecting mothers, a nutritional requirement for a growing fetus in the womb.
The foundation for these conditions will already be laid even before you are certain that you are pregnant. Yes, so the foundation will already be laid. So it's essential to have even be taking the folic acid even before pregnancy. Now the body has some reserve, but by the time you are pregnant, you may exhaust your reserve. So you should still continue taking. And then you may also want to look at your neighbor. You may also want to start comparing notes and say this person didn't take folic acid and the person turned out fine. But there are some enabling behaviors the person may be engaging in that you are not. The person may be someone that takes fruits and vegetables regularly. The person may have a huge bank of folic acid, and that may be why the person may escape it. The amount of headache you will prevent yourself from having by simply taking folic acid is uncountable. You will be doing yourself and your unborn child a huge favor.
The only treatment option is a brain surgery, and then a therapy to allow the affected child live normal again.
A child that comes out of a hydrocephalus might end up living with cerebral palsy, and if they are properly managed, some do walk, some learn, and then become graduates, and then some can learn skills. It depends. Sometimes it depends on their parents' exposure, and let's say I would even say their parents' inputs. There are some kids that we have handled that they have never had therapy, and they're like, I've had to go to Agbara to see a child before. The girl is 8 years old, was 8 years old last year, but has never sat on her own, was bounded because the mom didn't even know what to do. So some of these things is that, you know, I cannot know if you have a child like that in your house, except when you come out and say, I need help.
Early detection of this ailment is another way to defeat this condition. And here are a few signs to look out for. Rapid increase in size of head, eyes fixed downwards, excessive sleepiness, low muscle tone and strength, vomiting, delayed growth, and trouble eating. But little Blessing passed on shortly before this report was concluded, and his parents are gradually coming to terms with this reality. Doctors advise women of reproductive age to take in prenatal vitamins early enough to prevent any fetal defect that may occur when conception takes place. Esther Makwariola, TVC News.